Hi, Dr. Nicole.
Hello, كيفك؟
Good. How are you?
Good, I'm doing well, thanks.
So thank you for being with us tonight. شوي عنا مشاكل الإنترنت. كنت تحملوا معنا بس it's a very nice topic that you chose to tackle tonight. We have a lot of people who are attending who are interested in dealing with their social anxiety. يمكن a lot know what is social anxiety, how do we define it, how do we manage it, when do we seek help, and if it's okay to live with it or not. So we're very eager to listen to you, to listen to your pointers. ومثل العادة, you always give us hope and end with positive tips and coping strategies that يعني عادة هيك دايما بالسيشنز تبعي we get out with tools and coping skills that help us in our lives to have healthier lives. So a big thank you for being part of our core team and for giving your time back to community. أنا before I let you introduce yourself and لأنه في معنا new joiners كمان, I just want to remind the attendees اللي أول مرة على سيرة, نحن ما بنقشعكم وما بنسمعكم on the live roundtable. So we are streaming live now, Dr. Nicole, so you can see us. We are live with you. The only way you can interact with us now is through Q&A. So on your phone عندكم Q&A, فيكم تسألوا سؤالكم بالQ&A and you can ask your question anonymously. So تما يطلع اسمكم بالrecording, ask your questions anonymously. رح نقضي مع دكتور نيكول تقريبا يمكن 40-45 minutes when هي عم تشرح عن social anxiety, how to cope with it, how to manage it ما كنا عم نحكي, and then we will move to a safe space through the app. On the app we will create a safe space for you وبننقل كلنا سوا, وبهالسيف سبيس كمان ما بنقشعكم ولا بنسمعكم إلا إذا أنتم بدكم تطلعوا معنا live, and you can also interact with us anonymously or through chat. So مثل ما بيريحكم you can just listen in. الفكرة من كل سيرة إنه نحن we rely on the power of the community and the collective. So when we are together talking about a certain struggle بنساعد بعض وبنستفيد من خبرة بعض. This is all. كمان على الاب بنذكر الاتنديز معنا انه we have an adult and couple psychologist every Monday موجودة على الاب من 7 ل10 بيروت time. You can have a one-on-one with her for free consultations. الثلاثة عنا sexual health educator كمان بهيدا الوقت. It's all private one-on-one sessions. الأربعة عنا life coaches. الخميس عنا psychomotor therapist and a parenting psychologist. So please feel free to talk to our experts who ask them about your struggles. واستفيدوا. Support exists and it's free. That's all from my side. Dr. Nicole, I hand it over to you, and I'll be monitoring the chat also at the same time. Again, a big thank you for your time and your passion, and let's go. يعني ناطرين منك نحكي أكتر عن social anxiety.
Thank you, Sandra. As always, it's a pleasure for me to be here. يعني للجداد معنا اليوم إذا ما بيعرفوني, I'm a clinical psychologist, one of the providers on the Sira platform. يعني مثل ما ذكرت Sandra, Sira is a place for people to hopefully find something that they're looking for. يعني I love إنه في عنا هالثلاثة categories, شي للindividual, شي للcouples, وشي للparenting, ومنجرب نغطي يعني a wide range of topics. So really the whole point is إنه نحن to raise awareness about mental health struggles, to normalize it, ونخلي هيدا البلاتفورم a safe space للعالم تجي وتسأل أسئلة كمان مثل ما قلت بطريقة anonymous. فيلي ما بيرتاح إنه share their personal details, that's absolutely fine. We just hope that you can come here and gain the most out of it. كمان شغلة حلوة إنه كل هالجلسات بتكون pre-recorded, إنه بتكون مسجلة لبعدين. قصدي إذا الواحد بحب يرجع ويشوفها على وقت بيناسبه لإله. كمان I think that's a great thing either through the Sira platform أو كمان عبر اليوتيوب بيكونوا هالفيديوز مسجلين. So موضوعنا اليوم رح يكون هو عن السوشيال انكزايتي. بس قبل ما نفوت بهيدا الشيء ما حكيت عن حالي. So clinical psychologist موجودة أنا بأمريكا وبقدم خدماتي على telehealth services. So I work with the clients globally أكترية العالم اللي بشتغل معها بتكون عرب. So I think, the culture, the background sometimes draws people together. And my areas of specialty هن anxiety, trauma, relationships, and grief and loss. إذا بتحبوا تعرفوا أكتر عني فيكم تفوتوا على الويب سايت اللي هو www.meadowspath.com. وكمان فيكم تراسلوني ساعة اللي بدكم و hopefully I'll get back to you as soon as possible. So just again as a sort of an outline لليوم حنحكي عن شو هو السوشيال انكزايتي ورح نحكي شوي كمان عن شو هن الأساليب أو التكنيكس اللي بنقدر نستخدمها to reduce السوشيال انكزايتي اللي عنا إياه. وبعدين بعد هيدي الفقرة يعني رح ننقل على الرومز اللي هن رح يكونوا through the website. I think closer to the time ساندرا بتفرجيكم كيف تنقلوا من الزوم لهيدول الرومز. So I'm just going to pull up my PowerPoint. Great. Sandra, بتقدري تشوفي كل شيء from your side? Awesome. Okay, so مثل ما قلت رح نحكي شوي عن شو هو السوشيال anxiety, what it looks like, what sort of thoughts we experience, what physical symptoms are accompanied with it, شو هن behaviors اللي بتكون associated كمان مع social anxiety. و again الفوكس كمان رح يكون عن coping strategies. يعني السبب اللي نحن اخترنا هيدا التوبيك هو actually لأنه couple of weeks ago أنا وساندرا كنا عاملين anxiety support group ولقينا أنه كتير كان في interest بهيدا التوبيك. يمكن نحن كنا متوقعين انه حيكون اكثر عن generalized anxiety, but in fact a lot of people showed interest in social anxiety. So قلنا يلا why not, let's cover this topic. It clearly needs to be addressed. So شو هو social anxiety? social anxiety هو perception أو الطريقة اللي نحن بنشوف حالنا أنه نحن غلط أو عم نعمل شيء embarrassing قدام العالم. منخاف إنه العالم يكون عندها هيدي الصورة عنا. So نعطى الهم عن صورتنا المثالية تكون مشوشة قدام عيون الآخرين. That's really what it is. It's our perception of us feeling like we're being seen as wrong. حطيت هيدي الصورة هون تبع البيمبل لأنه I thought of it as something relatable. إنه أكيد كل واحد منا بيقطع بمرحلة لما suddenly يطلعوا هول الحبوب على وجهه and we become very self-conscious وما فينا إلنا ما نشوفها، مندقق عليها كتير ولإلنا يمكن أكبر كارثة. بس يمكن الأشخاص حوالينا ما بيكونوا منتبهين لهيدا الشيء. يمكن بيكون شيء بسيط للعالم حوالينا but for us it's everything. وأكيد شو بنعمل كردة فعل؟ بدنا نغطي هيدي الحبوب. bless you ساندرا. so بدنا نغطي هيدي الحبوب، بنحط كريمات، بنحط ميك اب، شو ما كانت، لأنه we don't want it to be shown. We want to conceal it. We want to hide it. Social anxiety can be thought of in the same way. عنا هيدا الخجل أو القلق أو الخوف الداخلي اللي نحنا we want to just hide away from the world, meaning يمكن نتجنب نكون sometimes in specific social settings because of this type of fear. So هيدا الخوف والanxiety اللي عم بحكي عنه بيكون ongoing و it's persistent. So موجود أكترية الوقت، والأشخاص اللي عم بيعانوا منه حيلاقوا انه it's affecting their daily lives, whether it's affecting their relationships with people at work, affecting their relationships with their friends, with family. حيلاقوا انه it sort of seeps in. واحدة من الاشياء اللي العالم عادة تسألني انه شو هو الفرق بين الخجل والسوشيال anxiety. الخجل هو شيء نحن كلنا بنحسه من وقت لوقت وشيء طبيعي، وإذا نحن عنا هيدا الشعور بالخجل مش بالضرورة أنه نحن منتجنب certain situations. Even if we're feeling shy, we somehow find it in us to go through with certain things. بينما لما عم نحكي social anxiety بيكون في avoidance، وهيدا بيكون ال ongoing negative thoughts, it's taking over. So هيدي هي really one of the main distinguishing features بين ال shyness وال social anxiety. كمان تنحكي شوي أكتر عن الباك جراوند of social anxiety عادة ببلش بعمر المراهقة, so between the ages of about 9 to 19 years old. هيدي الفترة اللي نحن we notice إنه ببلش السوشيال anxiety. هيدا ما بيعني إنه ما فيها تبلش قبل. أكيد السوشيال anxiety ممكن نشوفه عند الأولاد اللي هن أصغر from 11 years old or 9 years old, but usually the onset تبع social anxiety is the teenage years. كمان ممكن نلاقيها إنه it starts a bit later for some people, 20 plus, but again normally like I said between the ages of 11 to 19. كمان حسب الأبحاث اللي نحن شايفينها وهيك it seems إنه it's more prevalent in women. هلا هيدي الشغلة I'm not so sure if it's true, لأنه نحن بنعرف إنه usually women access mental health care services more and are more vocal about their mental health struggles. So truly, statistics can lie. I can't say that we can agree on this, إنه only women are the main sufferers. أكيد في men suffer with social anxiety, but maybe we don't have enough data just to support that. شوي عن الterminology. social anxiety بالزمانات كان اسمه social phobia actually, وقبل 1994 يعني كانت هيدي الترم اللي كنا نستخدمها. و in fact they used to only use this term to identify الأشخاص اللي عندهم خوف from performing in front of others. So public speaking إذا بدكم was really the understanding of social phobia. بعدين لاحظوا إنه actually social anxiety can be applied to many other settings, مش بس بالضرورة performance related. فبعد هيك Diagnostic and Statistical Manual of Mental Disorders اللي هي إذا بدكم go-to book for all mental health conditions غيروا الاسم from social phobia ل social anxiety disorder. ومثل ما قلت they expanded على الكرايتيريا to include other types of social anxiety, excuse me. مثل أكترية الأشياء اللي probably by now صرتوا تعرفوها when it comes to mental health, things are on a spectrum. So نفس الشيء مع social anxiety, it can be mild, it can be moderate, or it can be severe or extreme. إذا عم نحكي شيء mild بيكون في الفيزيكال والسايكولوجيكال symptoms اللي حنحكي فيهم بعد شوي, وعادة الشخص هون بيقدر to tolerate being in social settings. moderate هون منلاقي إنه الفيزيكال والسايكولوجيكال symptoms كتار بيزيدوا أكتر, وهون الشخص بيتجنب السوشيال situations. extreme بيكون في أكتر intense symptoms وكمان physical symptoms بيزيدوا مثل البانيك attacks, وهون الشخص بيتجنب all social interaction إذا بدكم at all costs. هي not necessarily إنه عم بيتجنبوا social interaction as much as again it's the fear of being negatively judged or evaluated. So as a result بيقولوا خليني أنا to not be present. So hopefully that's clear. Sandra, any questions so far على الأشياء اللي حكيت فيها؟ Nope. Okay. Great. Okay. So one of the reasons why نحن عم نحكي بهيدا الموضوع اليوم هو لأنه if left untreated أكيد هيدي الcondition can become debilitating مثل ما ذكرت. If it's in the extreme condition خصوصاً الشخص كتير حيكون عم بيعاني and it can result in several things مثل poor education outcomes. يعني تخيلوا إذا في ولد عم بيعاني من social anxiety وهو بالمدرسة يمكن يلاقي صعوبة إنه يركز بالصف, يمكن أكترية الوقت حيكون تفكيره بالأشخاص اللي حواليه, شو رأيهم عني, شو عم بيفكروا فيي, شو بيصير إذا المعلمة نادت اسمي وقالت لي اطلع يعني قدام الصف واحكي شيء. So كل هيدا الشيء ممكن يأثر على تركيز الولد و can lead to poor education outcomes. ثانياً for someone that's maybe older ممكن نلاقي كمان إنه في decline بالjob performance, لأنه ما تنسوا anxiety again is all about this preoccupation or rumination بشيء معين ونحن ما قادرين نسيطر على هالأفكار. So رح نلاقي أكيد it manifests in areas of our life. يمكن النيتشر تبع relationships يكونوا هيك poor quality, not up to the standards that the person would want. ممكن السوشيال anxiety to result in other mental health problems مثل major depressive disorder or alcohol use disorder. Again, these are, if left untreated, it could be comorbid with these conditions or other types of mental health problems. بس أكترية الوقت بنلاقي إنه هول الاثنين are most prevalent يعني. كمان it can result in low self-esteem, trouble being assertive, constantly negative self-talk, being very highly critical, hypersensitivity to criticism, poor social skills, loneliness and isolation, and أكيد overall a decreased quality of life. So again, this slide is really to highlight how important it is for us to get help as soon as possible rather than to leave these symptoms untreated.
نيكول عنا سؤال الروتس تبعها من وين بتجي؟
I'm going to answer that question shortly. عنا section خصوصاً للcauses of what contributes to social anxiety. So hold your horses. Okay, so what is it like to have social anxiety? Just a grid that I put together to illustrate a few things that might be going on. So as we talked about, بيكون في avoidance of social situations, بيكون في feelings of inadequacy, بنحس إنه نحن we might be less than other people, إنه people around us are better, you know, whether that's they're better in their appearance, they're better in their intellect, they're better in شو ما تكون. بنضلنا هيك عم نعمل هالمقارنة. بيكون عنا fear of behaving in a way that's going to be judged negatively by others. We worry كمان إنه العالم عم بتشوف our anxiety. So of course with anxiety في physical symptoms حنحكي فيهم بعد شوي. بس الشخص اللي عنده social anxiety بيضل كمان عم بفكر بهيدا الشيء إنه هل يا ترى they can see it؟ طب if they can see it, what do they think about me? Again, it starts this negative spiral. And the person might be very self-conscious, thinking constantly about what they're feeling internally. وبيخافوا to be embarrassed, to look stupid, or to do something humiliating. في نوعين من السوشيال anxiety، ممكن تكون specific وممكن تكون generalized. So مثل ما أعطينا example قبل إنه السوشيال فوبيا بالزمانات كان specific للفير of public speaking. هيدا example of a specific type of social anxiety. Generalized مثل ما الاسم بدل إنه it's this discomfort and distress that we feel in almost all social situations. Where do we commonly experience social anxiety? So a whole list of things. I also have another column coming up, so bear with me. But social anxiety can be experienced in multiple settings, and these are just only a few examples, really. But being introduced to other people, whether these are people that we know a little bit or they're complete strangers, anxiety can come up. Being teased or criticized لما نكون نحن بموقف where we might be like the center of attention, when we are being watched بس عم ناكل بس عم نشرب in public, لما نتلاقى ب authority figures. authority figures هون ممكن يكون a teacher, مديرنا, maybe parental figures, anyone that we see as, you know, quote unquote important. Most social encounters, meeting with strangers can be very uncomfortable. Going around the room or table in a circle. So let's say إنه نحن قاعدين عنا اجتماع شي محل والشخص اضطر يقوم على تاني side of the room. يمكن هيدا الشيء كمان يسبب نوع من القلق. Interpersonal relationships, answering the phone, being at a party, being asked to perform in any way, being called on in class, going on a date, taking an exam, using the public restroom, or going to the store to return an item. Again, this is not a comprehensive list. I'm sure that there are many things we can also include, but these are, again, just where commonly we find social anxiety can be experienced. So physical symptoms, very similar to, you know, generalized anxiety or the way that you might think of anxiety. Heart rate increases, muscle tension بيكون موجود. يمكن نلاقي إنه involuntary عم بيصير عنا twitches بجسمنا, whether it's, you know, hand twitches or any other area. Typically, it happens around the face and neck. But again, it's different for each person. يمكن يكون في شوية trembling. واحد ممكن يحس بدوخة, يستصعب to swallow, يكون في dry throat and mouth, upset stomach, sweating, a host of things. أكيد this looks different for each person. You might find that in your specific situation, you experience one or two of these things or more. شو ممكن يصير لما نحن عنا social anxiety؟ في 4 types typically of behavioral things we do as a result. First thing we avoid, as we discussed, we want to avoid feeling this way at all costs, so we won't go to these situations. ثانياً, we escape or leave the situation by coming up with an excuse or anything in the books, you know, we get creative with it. We use safety behaviors. شو هن safety behaviors؟ مثل bringing a friend along everywhere we go. So إذا في شخص نحن كتير بنرتاح معه أو معه, we might always say, oh, you know, come with me to this party. I'm not going to go unless you come with me. So this is a type of a safety behavior. And for a lot of people, they want to ease their nerves and try to feel more relaxed. And so they might resort to alcohol or any other types of drugs. These can be illicit drugs or otherwise. But of course, as we know, كتير في substances, they will affect the chemistry of the brain and in some cases help people to feel relaxed, building up what they call quote unquote courage to go to these settings. So مثل ما قلت قبل إنه if social anxiety is left untreated, it could lead to more severe problems مثل dependence on substances. فأكيد نحن we would love to help people at much earlier stages. يعني مثل ما دايما بنقول prevention, 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 right? Like that's really what's important here. Okay, so someone was asking earlier إنه شو الروot cause تبع social anxiety, and hopefully this will answer that question. أول شيء, there is no single exact cause of social anxiety, but we know إنه في كذا factor ممكن يحط الشخص at more increased risk of developing social anxiety. شو هن؟ We'll start with past experiences. Past experiences such as a person's parenting styles. إذا الشخص كان عنده overly controlling or invasive parents, this could have an influence. Leading to fear, that's the idea. You know, if you're trying to find شو هو link, it's this fear. You know, if you're constantly told, oh, don't do this, don't do that. So unconsciously, the child might start learning to fear so many things, including being around others, being perceived. أو مثلا إذا كمان منلاقي إنه الأهل هن بحد ذاتهم كتير بيهتموا برأي الآخرين ودايما بيقولوا يي شو رح تفكر هلأ الجارة، يي شو رح يفكر عمك عنك، يي طب ليه. These kind of, you know, statements إذا بيتكرروا over and over and over, ممكن الولد, you know, models the parental behavior and takes on that anxiety. إذا الشخص قطع bullying experiences, of course, it could be impacting to their sense of self, to their self-esteem. Going through stressful or fearful events without it being addressed appropriately. So in other words, بتكون هيدي الevent traumatic. لما الشخص يكون ب situation that was very unpleasant, it could be a one-time thing, it could be multiple times, but again, it has a lasting effect on the person. Family conflict, ومثل ما ذكرت trauma. So هول more related to, إذا بدك, environmental factors. Okay, so كمان بنعرف إنه temperament could also influence whether or not we have social anxiety. شو هي temperament? Temperament can be thought of as a trait, as a natural trait that each person has when they are born. I'm sure you might have heard about how, oh, في هيدا الولد يي شو هني ويي, there's another child who's so quote unquote fussy. You know, sometimes we give these types of descriptions to children, even though, of course, as parents, we might be providing them with the best care possible. We still notice إنه كل ولد رح يكون عنده their own personality or temperament. So children who are naturally more shy, withdrawn, بيخافوا شوي to interact in new situations, بيتجنبوا, they might be more at risk. Again, I want to just caution إنه هيدا مش بالشرط إنه every child who is shy is going to end up having social anxiety. But again, that's just what we know from the data. Inherited traits. So نحن بنعرف إنه anxiety disorders بشكل عام, they do run in families. So if mom or dad or teta or anyone in the family has some anxiety disorder, it's likely that a person might be at increased risk. So مش بالضرورة يكون كان عندهم هن social anxiety, but any sort of anxiety disorder. We also know that if the biological parents have هن themselves social anxiety أو حدا من الإخوة عندهم social anxiety, then this puts the person at even more risk. Thirdly, نعرف إنه الأميجدلا اللي هي a part of the brain responsible for controlling our fear response, نعرف إنه هي typically it's more activated or overactive إذا بتكون عند الأشخاص اللي عندهم social anxiety, which means إنه بركي هن كbaseline they might be more attuned إذا بتكون to scanning the environment for any possible danger or threat, and the anxiety response is, let's say, quick or immediate. وآخر شغلة هون بزيدها هي إنه our own beliefs and assumptions about ourselves, how others see us, and how we think we have to behave in public كمان له تأثير. وهون really ساندرا بيلعب كمان دور كتير مهم الثيرابي, because this is where we can help people, to help them challenge their belief system, to understand من الأساس طب كيف نشأ هيدا belief system, you know, because كتير في أشياء حتكون خارج سيطرتنا. So inherited traits ما فينا نحن نغير هيدا الشيء, right? Temperament كمان, يعني في أشياء genetic أو biological, let's say, that we can't of course change in any way, but what we do have control over is how we respond to things.
Does it go away? Can we really overcome it?
Yeah, you know, with consistency and persistence, yes. You know, I always like to give the example إنه إذا في شخص عم يشتغل على their physical health and signs up to the gym, if this person went once a month ما حيلاقي نتيجة أكيد. بس إذا هيدا الشخص committed to the gym consistently twice, 3 times a week, أكيد مع الوقت حيلاقي فرق بجسمه, بنشاطه, بكل شيء. نفس الشيء when it comes to working with this type of mental health difficulty. إذا الشخص عم بيجرب هن themselves to make some changes, you know, active changes in their life, and they are seeking therapy or they are taking medication or both, then yes, we do find that there are ways that certainly help people and they get better. But the key is, like I said, consistency and persistence. And it takes time. لأنه كمان ساندرا منلاقي إنه with social anxiety, actually في نسبة كتير عالية من الأشخاص they do not seek help, which is the nature of the issue itself, right? إنه في anxiety موجودة بتخجلي تحكي فيها, يمكن حتى بتخجلي تحكي مع أخصائي بهيدا الموضوع. So it's one of those that really we find a lot of people suffer in silence. كمان I probably should have mentioned this earlier, but most people might know إنه depression is widely prevalent. منلاقيها all over, you know, it's one of the top mental health conditions that we know exist. And the third most common mental health condition is actually social anxiety. You know, so that might be a little bit surprising to some people to hear that. But that's, again, it tells us how common it is. And from the types of social anxieties الموجودة, the most common type is the fear of talking in public. So the public speaking. Public speaking is the number one. Followed by, I forget, let me just have a look here. Oh yeah, followed by speaking up in class and meeting new people. هول top three types of fears.
Do you think it was already there and very common, ولا نحن هلأ باللايف ستايل تبعنا بطريقة التربية يمكن عم نأثر إنه يطلع عنا generations عندها أكتر social anxiety, أو صار في وعي أكتر الناس عم تحكي فيها؟
That's a really good question. You know, I like to believe إنه عم بيكون في توعية أكتر بهالمواضيع, especially من وقت COVID. I think that's been, you know, a game changer when it comes to mental health. كلنا عرفنا قد إيه مهم mental health نحكي فيه, including all of these topics. I think it's always existed. I just think that now we have a better understanding of it, ولأنه صار عنا better understanding ويمكن توعية, العالم عم تتشجع يمكن to approach professionals بهيدا الشيء. But I think it's always been there, you know. Yeah.
I mean, a mom is asking if she detected social anxiety in her child early on. Is there anything that can be done while the child is young, while they have to wait until the child is at least a teen or adult
Oh,
to
no. We don't want to wait. بالعكس, I think it's great that the mom has been able to identify and see that their child might be struggling, because now would be the time to intervene. We don't want to push it for later. So أكيد الانtervention مع أولادي بيختلف than the intervention that you would with an older person. But I would start by trying to understand, where does this child show the social anxiety. So مثل ما حكيت قبل إنه في specific وفي generalized. هل يا ترى في places معينة, let's say, that this child shows the social anxiety? Is it only related to, for example, going to school or being with a certain group of people? So collect more data to understand where the social anxiety is being shown, and also more information to know what exactly changed. So the mom is saying, I think my child has social anxiety. Based on what? شو هن الاشياء يلي هالمام عم بتشوفها that has really changed? Is it I don't know, certain types of behaviors that the child might be doing, مثلا having nighttime difficulties, مشاكل بالنوم, or again, the avoidance could be an obvious one. And لا, mom, I don't want to go here anymore. This could be an indicator. Or I'm sick. That one is a popular one, so يطلع حرارتي معدتي عم توجعني. Sometimes kids will start using these reasons. Not to say that every time they say that, automatically it's an excuse. أكيد sometimes a child is telling the truth, but these are just things to be careful with, just be aware إنه ممكن يستخدمون كexcuse. So yeah, I would encourage the mom first, collect more data. And in terms of trying to help that child, كمان على حسب عمر الchild, we might want to involve the school. It's always a good idea to have the school involved in some way to gather information من الأساتذة, to see how is this child behaving in class. Do they observe any changes? And then helping them to work with these feelings. One of the things we love introducing to kids is normalizing feelings. هيدي, it's so important, Sandra, إنه كل إنسان حيحس بالزعل, بالتوتر, بالقلق. We all experience these things. It's a problem when we experience them all the time and we don't know what to do with them. But when it comes and goes, that's normal. So we want to teach the child أولاً إنه what they're feeling is not bad, أو عيب, أو ما بيصير, or any of that stuff. We want to normalize it. And another thing is we want to help them to know شو يعملوا لما يحسوا هيك. يجوا يحكونا أو talk to their friends. Drawing and art can be a great tool for kids to express their emotions and thoughts. So that was a summary, of all the things that we could do. But, great question. يا ريت ركزت على هذا الtopic, but I didn't include anything specific للchildren اليوم.
I love it. All right, great. Thank you.
Sure. All right. So I guess a lot of people might be waiting for this part. What do we do? I think we all know social anxiety exists. Some of you here today might experience social anxiety yourself or know someone that has social anxiety, and you're thinking, okay, now what? So now what is, I've put together 3 strategies that I want to talk to you about, لأنه ما فينا نحكي عن كل الstrategies اليوم, بس hopefully maybe in the future أنا وساندرا عم نفكر نعمل a specific social anxiety support group. So بهيدوليك السيشنز حيكون المطرح اللي نحن we really learn more skills. بس اليوم I've decided to just talk about 3. So one strategy that helps is what we call challenging unhelpful thoughts. So شو يعني؟ 2 steps. أول شيء نحن we want to identify شو هي هيدي unhelpful automatic thought اللي عم تجينا. يعني مثلا إذا أنا هلا I'm in a public space and بلاقي حالي عم بقول أكيد عم بيطلعوا فيي لأنه عم باكل وعم بيفكروا إنه أنا عم باكل بطريقة غريبة، سو عم بيفكروا إنه أنا إنسانة غريبة. يمكن هيدا يكون negative automatic thought, right? And after I identify what my negative automatic thought is, I want to try to challenge it, because مش كل الأفكار اللي نحن بتجينا هي الحقيقة. أفكارنا بالنهاية مجرد opinions. A lot of the time it is only opinions or our assumption. So for example, عطيت هون demonstration. Let's say a person has the thought, I'm going to make a fool out of myself in the upcoming presentation and everyone is going to think I'm incompetent. we want to try to gently replace this automatic thought to, it's normal for me to feel nervous before a presentation. Like I said, we want to normalize things first and foremost. Secondly, even if people do notice, I am anxious, it doesn't necessarily mean they're going to conclude, I'm incompetent. So being, again, gentle with ourselves, less critical, to come up with more realistic, positive, balanced thoughts to counter the negative automatic thought. Now, I realize that sharing this with you today, Sandra, is much easier said than done. But again, that's really the work. Just like when we go to the gym, you want to train that muscle, it's not going to become in the way that you imagine by 2 or 3 sessions with your personal trainer. It's going to take time to build that muscle the way that you want it to be, to build that strength. نفس الشيء when it comes to our thought patterns and how we talk to ourselves. Practice, practice, practice. Okay, secondly, the tip I want to share with people is shift your focus. شو يعني? A lot of the time, we're so focused on what we are experiencing in our body. Sometimes we draw conclusions based on the physical responses our body is giving us, thinking that something terrible is going to happen. And again, we become hyper-focused on شو عم بيصير جواتنا. Instead, I would invite people to pay attention to what people around you are saying. When you're in a public space or a social setting, engage in those conversations. Be curious. What are people around you talking about? What are they saying? So be intentional about your surroundings, the conversations that are taking place. هيدي كتير بتساعد وبتخلي الشخص يعمل shift from being self-conscious and hyper-focused on their bodily sensations to something more of a connection and a relationship that's being formed. لما هيدا البروسيس تصير naturally, الانxiety بيصير يخف. So that's the giveaway for how to shift focus. Try to engage in those conversations. إذا ما لقيتوا something engaging مع الشخص اللي حدكم, maybe move around the room. Even if you don't want to initiate the conversation, standing there with them to be an active listener could spark your interest. So that's tip number 2. Thirdly, I'm going to talk about breathing here. So normally, Sandra, لما نحن يكون عنا anxiety, our body goes into fight, flight, or freeze mode. And what happens is that we start taking short and quick breaths. Sorry, just a moment. We start taking short and quick breaths as though we're being under attack, as though we're imagining, a bear sort of coming towards us. So our body reacts in a way as though it's under threat, and our breathing becomes out of control, so to speak. So one of the strategies that we encourage people to do to regulate their breathing. To regulate their breathing, في 2 types of ways we can do this that I wanted to share today. أكيد في more than 2 types, but as I said, due to the time constraint, I'm only going to share a few. So one of the things is what we call diaphragm breathing. Diaphragm breathing is لما نحن عم نتنفس with the focus of noticing the airflow into our stomach and out of our stomach. So it's not breathing from the chest. So let's try to do that together. إذا الواحد بيقدر يحط إيد على بطنه وإيد على صدره, what we want to do is not lift this area, بدنا our stomach to expand, مش our chest to go up and down. So we'll start by taking a breath from our nose while our mouth is closed, and then we're going to exhale from the mouth. So it's something like this. So you can't really see my stomach, but it's my stomach that's moving out and in. But I would do that for a few times. And I'm purposely doing this whooshing sound. We want to do that whooshing sound, kind of like we're releasing all of that tension and stress that's built up in our body. So that's what we call diaphragm breathing. Doing it consecutively a few times can help us to manage our breathing better, feel more in control. وبنفس الوقت نحن بنكون we are activating شيء بنسميه parasympathetic nervous system اللي هو عكس السيستم تبع survival mode. And another technique is what we call 4-7-8. بنفس الشكل كيف نحن بنبلش أول شيء breathing in from the nose. We breathe in from the nose for 4 counts. We can just mentally count that, in our head. So we breathe in for 4 seconds, we hold our breath for 7 seconds, and then we gently exhale from the mouth for 8 seconds. This specific technique is also helpful in helping people to feel more relaxed before going to sleep. So if you have any trouble with the evenings, you find it difficult to relax your body and go to sleep, I would suggest trying this 4-7-8 technique. There are lots of amazing apps out there or things you can find for free online, whether it's YouTube or even I think on Netflix, you might have access to Headspace. I don't know if they still have that available, but كان في فترة عندهم Headspace, some of their audios على Netflix. So you can listen to a guided audio where they will walk you through these types of breathing exercises, which really helps again to calm the body. لأنه مثل ما قلنا normally إذا نحن الانxiety موجودة, we're feeling all of these things in our body, we become hyper-focused, it becomes very uncomfortable, we read into these signals and think something horrible is going to happen, we catastrophize. So what we want to do is say, hey, wait a minute, I might not be under threat. I'm perceiving things like I might be under threat, but let me try to restore that sense of relaxation in my body. وهول التechniques can work. حبيت فرجي هيدي الصورة. I found it from the Very Well website, which by the way, Very Well has a podcast for those of you who don't know. You can download their audios, listen to their podcast. They have a bunch of great things covering different topics. But, this picture here shows us how there are self-help things that we can do too. مش بالضرورة the only way to get better is to seek help from a professional. There are things you can do as well, such as keeping a journal, becoming your own advocate, congratulating yourself for the small achievements that you do. So for example, if let's say you have a fear of being around large groups of people, if you manage to go out with 2 or 3 people when normally you go out one-on-one with people, that's an accomplishment, yay. So congratulate yourself for taking those steps because they're not easy. It's not easy to break from that vicious cycle. And then ما حكينا كتير عن العلاج، بس أكيد في أنواع العلاج كمان that's very helpful اللي هو ال CBT أو العلاج المعرفي السلوكي and medication. So
قبل إذا بدك قبل ما نبدأ العلاج عندنا كتير أسئلة. Maybe
okay,
wanna a few questions and then we can continue. Okay.
بدك شوف اوكي في اشياء
لا
بتشار.
أنا رح أقول لك إياهن. Can living in poverty be a cause to social anxiety?
Can living in poverty be a cause to social anxiety? Yes, it can be. As a simple answer, yes or no, yes, it can be. In terms of how that's related, there are many things that we can think of. But yeah, the socioeconomic status تبع الشخص ممكن يأثر. Again, these are environmental things that can have an effect. كمان على حسب what those actual living conditions look like for the person. Not enough, I think, research has looked into this specific factor. It's not one of the common ones we see as the ones I talked about, بس أكيد ممكن تلعب دور.
Okay. Comment من حدا من ال users تبعنا. Sometimes when I'm comfortable in a social setting, suddenly if something unpredictable happens, it can trigger my stress response and my face immediately turns red. And I get very anxious. Can you tell me, please, how I should handle such situations for it to be less awkward for me and for others?
For whoever shared that, I hear you. That happens to me sometimes. Maybe not in the exact same way, but my face tends to flush very quickly, and I become very self-conscious of that. Oh, now people can see it. But what I learned, honestly, is one way is to not be so judgmental and critical of myself. My physical responses are, my body sensations and physical responses are normal. If it does show, if my anxiety does show, it's okay. It's probably going to pass. And I don't see it anymore as a reflection of who I am as a person, right? So I think that's one way that you can think of it as well, is that doesn't have to define you. It's okay if your face flushed. It's okay if your hand was shaking for a little bit. It's okay for it to show, because it's going to pass. It makes you human, and it's not a reflection of who you are. So those are a few things I would encourage you to think about, because speaking to yourself in this compassionate way is gonna be way more helpful than saying, instead of that vicious cycle, right? So it goes back to challenging those unhelpful immediate thoughts. So I hope that helps. I'll take the next question, Sandra.
All right. Thank you for addressing this topic. I'm surprised that this subject, that I am personally affected with this being discussed, even though it's not severe. I would have never thought it would be talked about at this level of professionalism. It's not a question, a comment.
Thank you for sharing that.
What approaches of therapy help most in case of moderate social anxiety?
So CBT. CBT is the way to go. So research بتدل إنه there's a lot of evidence base for CBT, irrespective of whether it's mild, moderate, and or severe, because the strategies اللي تستخدم بالCBT are super useful. So for those that might not be familiar with CBT, it stands for cognitive behavioral therapy, اللي هو the idea that we tackle our way of thinking in addition to tackling what we do as a response. So أنا كنت عم بحكي عن كيف أكترية الوقت نتجنب المطارح اللي ممكن تسبب social anxiety. With CBT, for instance, you would set a goal with your therapist to gradually start exposing yourself to these types of situations. Now, I know that might sound like too much and it's anxiety provoking just hearing it, but again, done with your therapist in a safe, contained way can be very encouraging and rewarding. So بدنا نشتغل على الحبلين بنفس الوقت إذا بتكون. That's why a CBT approach works. In addition, في شيء اسمه acceptance and commitment therapy. كمان a lot of studies بيفرجوا إنه it can be effective, because with acceptance and commitment therapy اللي هو كمان عنده كتير similarities للCBT بس not in a traditional sense. acceptance and commitment therapy كمان بيفوت شيء اسمه mindfulness. So we do know إنه mindfulness and ways to become more present in the here and now وهيك كمان بيساعدوا كتير. So anyhow, point being, CBT approach هو بيساعد in addition to medication. So للمedication ما حفوت كتير بهيدا السبجكت كوني أنا مني psychiatrist, but all I can tell you is that with the meds, typically what might be prescribed is antidepressants. So antidepressants and not anti-anxiety medication, لأنه anti-anxiety medication عادة they work short term, بينما antidepressants can work more for long term. كمان in some cases, certain types of blood pressure medication is prescribed. Anyhow, to each case أكيد بيختلف. If anyone is wanting to get help for their social anxiety, depending on how severe it is or not, those are the two ways. Sometimes one of them alone, sometimes a combination of both. That would be up to your care team and things like that. So gentle reminders before we wrap up and move to the room is you are more than your social anxiety. It doesn't define who you are. And the sooner you get help, the sooner you'll begin to feel better. So للمام اللي كانت عم تسأل قبل كمان على her child who's starting to show social anxiety, now's the time to address. You don't necessarily have to take the child to a professional right now if you don't think it's severe. There are strategies you can do as a parent, etc. But those are the key messages. And then the book I wanted to recommend is How to Be Yourself. And the writer herself كمان هي بتعاني من social anxiety. So very relatable, she's been in those shoes. And it's a really great book if you want to pick up a book to read. So that's it for this, segment here. And I'll be taking some more questions بالأوضة.
بعد عنا أسئلة نيكول، رح نجاوب على كم سؤال هون وبنرجع ننقل على الروم with people.
Okay. Yeah.
لأنه already انسألوا الأسئلة, so let's go
Okay.
through them.
Sure.
Okay. All right. So how can I help a friend with social anxiety in public? That's a nice question.
That is a nice question, which is also a topic I didn't necessarily talk about, how to support our loved ones. So a couple of things. I think starting off by asking your friend, how do you want me to support you in those situations? Sometimes نحن, بيتهيأ لنا إنه doing XYZ is the best thing, but rather than assuming, I would encourage you to have an open heart-to-heart conversation with your friend. Ask him or her, how do you want me to support you? That's one place to start. Another thing is to also be the person to remind them of the prompts that work. So إذا هن بيستخدموا certain strategies that put them at ease, مثل the breathing technique, you can be the person to say, hey, I'm noticing you're getting a little bit tense right now. Do you want to try this technique? Because they might be so caught up again in their own thoughts, right? So those are a couple of things you could do.
All right. Do we when it happens, should we discuss this before, or when it happens point it out, or you في عندك tips على when it happens or before? Should it be handled before?
Yeah, so كمان social anxiety, one of the features هو إنه بيصير عنا هيدي preoccupation بالأشياء اللي ممكن تصير قبل بأسابيع. Let's say I have a presentation that's due in 2 weeks. ببلش أنا أفكر من هلا أو لا شو بدي أعمل, كيف بدي أحضر, I might have sleepless nights, and I might I might either procrastinate or overwork, whichever response I have. So yeah, one of the features of social anxiety is that these types of thoughts take over before. So we do want to tackle them بهيدا الوقت. كيف أنا كمان كنت عم بحكي عن learning to challenge unhelpful thoughts. We want to do something ASAP. We don't want to leave things for the last minute. Yeah.
Okay. كمان عنا comment. We'd really appreciate a social anxiety support group. So yes, we're doing one.
Love that.
Next. Yeah. Okay. When I'm in a social setting, I focus so much on my posture. Is this a physical symptom of social anxiety?
So it's what we call being self-conscious. So it starts off more as a thought somehow that, يمكن أنا my posture غلط, أو يمكن عم ينتبهوا على my posture. It starts with some sort of a thought typically. And then we become hyper-focused on that bodily experience. In your situation, it might be posture. Again, I think what we want to do is to restore that sense of safety and relaxation in the body. So for this person who's asking, I would strongly advise that he or she do some of those relaxation exercises beforehand, just again to activate اللي نحن بنسميه parasympathetic nervous system. So getting into that mode just to ease the body before we put ourselves in the uncomfortable situation. And then when it comes up, because it might come up, as I say, but you become again more focused on the posture, being gentle, like, okay, this is my mind again, paying close attention to the body. Let me shift my focus from the body to what's happening around me right now, whether it's people are talking, مثل ما قلت, show that curiosity, هالاشياء.
Be more present.
Sure.
Okay. My child thinks a lot and asks a lot of questions. He is 5. He doesn't have the guts or the courage to ask a friend if he wants to play. He asks me instead to ask his friend. He always asks what would happen if I do this. So how can I help him make friends, and how can I help him directly communicate?
So, firstly, hearing just that description makes me think that that's quite normal, what we would expect to see in a child, because children normally are more comfortable with their caregivers, and so they will come to them for questions. Or again, هيدا أول attachment is formed, مزبوط إنه عادة with our caregivers. So شيء طبيعي إنه الأولاد بيلجأوا للأهل قبل الرفقة. But maybe, if your child is vocal and able to articulate him or herself, saying, what is it that's stopping you from asking your friends? What are you worried might happen if you ask your friends? Just to understand your child's thought processes, or كمان to model that behavior. So the parent can, in front of the child, go and talk to the friend and ask that question, you know, showing that there's no threat or danger in this area by doing that.
Alright. أصلاً يعني إذا anyone who asked the question or the people who are attending, they have a follow-up, نحن we invite everybody to continue with us to the room. رح نطلب بس شغلة من الاتtendees اللي عم يحضروا معنا. قدامكم on the app you have a section called poll. So نحن حطينا a poll out there. How did you find إذا you found the session useful? Are you more aware of how to overcome your social anxiety? It helps us also know if we were able to relay the message. So please على البول you just click عندكم option yes agree or somewhat agree or don't agree. So بتساعدونا هيك تنعرف إذا عم نقدر نوصل المسجز مزبوطين إنه بطريقة منيحة. وأنا رح فرجيكم كيف ننقل على الروم لأنه رح نكفل discussion تبعنا بالروم. مثل ما حكينا بالأول نحن هلأ we are live with you عم نسجل and we would like to continue this discussion in a safe space. بالsafe space ما منسجل أبداً. We stop the recording. There's no recording. خلقنا safe space room. So قدامكم على الاب on the menu بتقشعوا كلمة room. You press on it ورح تشوفوا الروم انخلقت هلا for social anxiety. رح ننقل عليها. In the room we don't hear you and we don't see you at all. Okay, you can communicate with us through questions, chat مثل ما هلا عم تعملوا. بتسمعونا نحن. The only way if you want to talk to us is to raise your hand. So أنتوا بدكم تنقوا أنكم تحكوا معنا تنقدر نسمعكم ونقشعكم وتخبرونا أكتر عن خبرتكم. كتير مهم إنه كلنا سوا نلتقي. So please continue with us to the room تنحكي أكتر عن هالموضوع وتقدروا تتواصلوا directly مع دكتور نيكول to share your experience. هيك تقدر تساعدكم أكتر و you can help the group كمان لأنه وقتها من نخبر أو منتشارك خبرتنا نقدر نساعد غيرنا كمان أكيد. So Dr. Nicole أنا I'll stop the share. Please don't forget to answer the poll والحقونا على الأوضة the virtual room يلي خلقناها تنكفل discussion مع Dr. Nicole. Thank you Doctor.
See you.
Stop the live and see you in the room.